So let's go over how to guide people to improve their core activation strategy and the breathing mechanics. When we see Buddha belly breathing, where their front abdominal wall is excessively stretching as they breathe in without the proper expansion of the rib cage. Okay, for this, I would use what's commonly called as a transversus abdominis activation method. I would find her front hip bone, technically speaking, our anterior superior iliac spine. And then I'm gonna slide my fingers slightly towards the middle until I find the flat muscles above the inguinal fold. And then I will simply ask her to, can you feel this muscle and can you tighten this muscle? And some people can tighten this well, or some people can tighten it and also over tighten their outer muscle. And we don't want to over tighten this muscle to be able to tighten this area, this lower area. So to be able to check, I would ask her to gently activate this area underneath my fingers and see if she can still breathe in and out freely. If they're over bracing, they'll have a hard time breathing in and out. Okay, so if they have no idea how to activate, or if they overbrace their outer core, outer abdominal muscles, then I would use 3 different cues to see if they can improve this. First cue I would use is that have them imagine there's a line that connects the 2 bones together like this, and ask them to see if they can kind of contract the line as if these 2 bones are getting close to each other. That's one method. And if this is not working, then we can use what is commonly called an abdominal draw-in method. So I would ask her to breathe out as the belly button sink down to the spine. And then ask her not to let the belly button pop out as she breathes in again. Nice. And if this doesn't work, then I would ask her to imagine that there is an urge to pee and she's contracting their inside to stop the pee from flowing. This is actually, the last one is actually activating the pelvic floor, but it usually works to activate other deep core muscles, namely transverse abdominis. So once they can learn how to activate this, then I will ask them to activate this about 30% or so, and then have them breathe in and out. And again, I want to redirect their air to the side and back part of the rib cage. Now I'm going to talk about why we're palpating this area. So this area is where the deep core muscles and the outer core muscles are kind of merging into the common layer of the fascial sheath. So by palpating this, we can gain some idea as to whether they or not they can activate the deepest layer of their core, which is transversus abdominis. As long as we understand that this is not an isolated activation of the transversus abdominis activation, I have no problem of people calling it a transversus abdominis activation method.